Good evening. My name is Juan Carlos Molleda, Edwin L. Arts Dean and Professor of the University of Oregon School of Journalism and Communication. It is my pleasure to welcome you to the 2022 Richard W. and Laurie Johnston Memorial Lecture. I would like to tell you that we are recording this talk and we'll email it to all registrants in the coming week or so after we have captions in place. The Richard W. Johnston Project at the University of Oregon School of Journalism and Communication was established in 1984 to honor Dick Johnston, a 1936 graduate of our school and one of the founding editors and an executive editor of Sports Illustrated. Dick began his career at the Eugene Register Guard, moved to the Portland Journal, and then was a war correspondent in the Pacific Theater for UPI. After the war, he was on the staff of at Time Magazine, then moved to Life Magazine before joining the team that created Sports Illustrated in 1953. The School of Journalism and Communication inducted Richard Johnston to its Hall of Achievement in 2001. Laurie Johnston, a 1936 graduate of our journalism school and Dick Johnston's wife, established the Johnston Project in 1984. An accomplished journalist in her own right, she covered World War II in the Pacific for Reuters and reported for Newsweek. She was also a columnist, editor, and reporter for the New York Times, where in 1980, she won the Major Berger Award for Distinguished Reporting. In 2004, she too was inducted into our Hall of Achievement. The annual Richard W. and Laurie Johnston Lecture Series is made possible by gift from the Johnston family, George E. Jones of U.S. News and World Report, and the Correspondence Fund. This series brings professionals to campus or virtually to discuss thorny issues today's journalists face, including how to meaningfully engage people of all communities with sciences. I'd like to thank our sponsor, the SOJC's Center for Science Communication Research, as well as our partners, the Phil and Penny Knight Campus for Accelerating Scientific Impact, the Just Futures Institute, and the Center for Latino, Latina, and Latin American Studies for helping to bring you this lecture tonight. This year, we are delighted to host scientist turned communicator, Dr. Mónica Feliú-Mójer. I will let Dr. Ellen Peters, Director of the SOJC Center for Science Communication Research, to introduce her to you. Dr. Peters, a doctoral graduate of the U of O, University of Oregon, returned to Eugene in 2019 to serve as the Philip H. Knight Chair and Director of our Center for Science Communication Research, or SCR for short. The SCR aims to make science more widely accessible by enhancing the conversation between scientists and society, because scientific knowledge is useful only when we are aware of it, understand it, and apply it to our lives. Dr. Peters' work focuses on how people understand the use of numbers and other information as they evaluate risk and make decisions. She's a leading decision and risk expert at the U of O, examining, for example, how people make health decisions in the face of a public health crisis. She also worked with colleagues across campus to share and disseminate information about the pandemic. Please join me in welcoming Dr. Ellen Peters.
Thank you, Dean Moeda. Making complex science useful to improve people's lives is absolutely central to our mission at SCR, and it's exactly why we invited Dr. Mónica Feliú-Mójer. Combining a PhD in neurobiology with a background growing up in a working class community in rural Puerto Rico, Dr. Feliú-Mójer's work focuses on engaging historically underserved and overlooked audiences with science, and especially on engaging Puerto Ricans and other Spanish speakers. Since March of 2020, she's been promoting COVID-19 prevention and vaccination, as well as improved mental health through science engagement and as well as multimedia education. Her science communication and advocacy efforts have helped Puerto Rico achieve some of the highest COVID vaccine rates of any state or territory in the United States. And one of her projects earned the Falling Walls Breakthrough of the Year 2021 Award in Science Engagement. This is an honor recognizing the most outstanding project breaking the wall between science and society. It is such an honor to have Dr. Mónica Feliú-Mójer join us tonight to discuss how storytelling and cultural relevance can be powerful tools for effective and inclusive science communication. She applies a cultural lens to science communication and storytelling to make science more equitable and inclusive, and she seeks to change stereotypes about scientists of color. Through science communication and mentoring, she helps underrepresented scientists step into the power of their identities and stories, thus catalyzing their career development. Dr. Feliú-Mójer serves as Director of Communications and Science Outreach for Ciencia Puerto Rico, a nonprofit and global community of more than 15,000 scientists, students, educators, and allies, creating social impact in Puerto Rico. There, she leads communication strategies in several communication and outreach efforts, including a project focused on promoting COVID-19 prevention and wellness in Puerto Rico through community and science engagement, and again, multimedia content. She also serves as the director at Science Communication Lab, an innovative nonprofit organization dedicated to using multimedia storytelling to engage the public in the journey and the wonder of science. And she was the lead producer of Background to Breakthrough, a collection of short films expanding the definition of who can become a scientist by showcasing how scientists of color have succeeded because of their backgrounds. Her work has been featured on Telemundo, Latino USA, and Google Arts and Culture, as well as in El Nuevo Dia, the Los Angeles Times, and Scientific American. Dr. Feliú-Mójer is an Emerson Collective Fellow. She is part of the collective's Recover and Renew cohort, a cross-disciplinary group committed to exploring how issues of equity and justice have shaped the pandemic and how they will help lead the way forward to a better future. Tonight, Dr. Feliú-Mójer will share examples of how storytelling and cultural relevance can be applied to meaningfully engage different publics with science, and especially historically marginalized populations. If you have any questions during her talk, please feel free to enter them into the Q&A module at the bottom of your Zoom screen. We're leaving time after Dr. Feliú-Mójer's talk to answer many of your questions during a Q&A that'll be moderated by Dr. Holly Smith, Associate Director and Founding Researcher of SCR. And now, if you will, please join me in welcoming Dr. Mónica Feliú-Mójer.
Thank you so much for that introduction, Dr. Peters. It's truly an honor for me to be this year's Johnston Lecture. I want to thank the School of Journalism and Communication, Dean Molleda, Dr. Peters, everyone at the school, at the Center for Communication Research. I also want to thank Lena Freeman and Ian Winbrock, who've really been supporting and making sure that everything goes smoothly. So thank you so much for your help. And of course, thank you everyone for joining us today. I'm going to start the uncomfortable process of sharing my screen. And while I do that, I really hope that we can have a conversation about storytelling and culturally relevant science communication and how those can be tools and strategies to engage different publics with science. If you want to share some of what I'm saying on Twitter, or if you want to share questions or connect with me later, you can find me at Mónica Feliú. I'm pretty active on Twitter. And so I want to get started actually by asking you all a question. What makes you feel connected to science? Now, I know there's probably not all of you are scientists, but science is all around us. It touches our lives in many ways. So if it's not making you feel something that makes you feel connected to science, what makes you curious or interested about science? What makes science meaningful to you? And while you reflect on that, and if you want to share that on the chat, you're welcome to. I won't see it now, I'll see it later. But while you do that, while you think about that, maybe while you type that or write it out in a notebook, I'll tell you what makes me feel connected to science and what makes science meaningful to me. Science is meaningful to me because of the beach and lizards and cows and people, particularly people that work the land. And these are all things that relate to Puerto Rico, which is where I was born and raised. And why am I telling you these? Like, all of these things about Puerto Rico make me feel connected to science. Well, because our culture, our experiences, our identities, our values, our previous knowledge, all of those things, they influence our interests and our approaches to science. And as someone who grew up in rural Puerto Rico, in a rural working class community, those surroundings, the cows that I grew up with here in the picture, you're seeing my cow, Carla, she's now passed. But all of these things, they make me feel connected to science because these surroundings, these experiences that I had growing up are the things that initially made me interested in science. However, even though I was really interested in science as a kid, science felt distant to me because all of the references that I saw on TV, on the media, even on books and in school, they looked like this. This is a promotional image from a show called Beakman's World. And it's a show I used to love watching as a kid because they would ask questions and do experiments. And while I loved what they were doing, I didn't quite identify with what I was seeing and what I was hearing in the show, because the main character, Beakman, he is unsurprisingly a white man with crazy hair and a lab coat, the stereotypical scientist. And even though there was a little girl in the show, she didn't look like me, she didn't sound like me. This show was produced originally in English, dubbed into Spanish, but their Spanish didn't sound like mine. And so all of these references that I had about science and what being a scientist was like made science feel foreign. It made science feel distant and sort of irrelevant to my reality, to who I was. And unfortunately, this is not an uncommon experience for people that share some of my identities and background, because too often science is as decontextualized, it's disconnected from, and it excludes and overlooks the realities, the culture, and the experiences of people from marginalized identities. But fortunately, storytelling and culturally relevant science communication, they offer ways to address these challenges. And so today, I'm going to tell you a little bit about how storytelling and culturally relevant science communication can do that. And I'm going to share some examples from the work that I do with Ciencia Puerto Rico and the Science Communication Lab. But before I go into that, I wanted to talk a little bit about why stories, why cultural relevance? Well, because when things are relevant to our culture, to who we are, and storytelling itself, we use all of that information. We use a cultural lens, we use stories to make sense of information, to make sense of our world. And particularly stories and storytelling, they've been part of humans for a long, long time. Stories are part of most cultures, if not all cultures, and how we share knowledge from one generation to the other. Our brains love stories. They really do. And stories and culturally relevant communication offer ways to connect science with the realities, the values, the identities of our audiences. They can make people feel seen. And because of all of these things, storytelling and culturally relevant communication make science pertinent, more accessible, and most importantly, actionable for people. So I'm going to share one of my favorite examples of culturally relevant science communication. And it's, what you're seeing here on the screen is the seed pod of a maple tree. And for people in North America, this mini helicopter-shaped seed, it's a good contextualized example of seed dispersal, of this universal concept of seed dispersal. Essentially, seeds use their shape, to make sure that their seeds disperse and go further. And this is a great example, again, for those of us who are in North America, but for people in tropical regions, like where I grew up in Puerto Rico, a more relevant example of seed dispersal is the African tulip tree seed. And this tree in Puerto Rico is commonly known as meaito. And it has seeds, these little seeds that are surrounded by a thin, kind of filmy wing. And they live in pods, these long canoe-shaped pods. And they're in there in the hundreds. But when these pods open, the seeds float in the tropical air. And I have very distinct memories of growing up. And I still, when I go back and visit my dad, especially when I go in the summer, I see these seeds everywhere, and they're kind of like gliding around in the air. And so this is an example of how we can use culturally relevant communication to make a universal concept kind of connect with the reality of folks. And I can guarantee you that in every place and every culture, you can find a locally relevant example of seed dispersal. And these strategies we can apply to pretty much anything. What you're seeing here on the screen is a screenshot of the very first newspaper article that I ever published. And it's meaningful to me, not just because of that, but it's because it's a really incredible example of how we can use culturally relevant communication and storytelling. And I'm going to read the first paragraph to you. I'm going to give you a warning. What I'm going to say, some of you might find this a little bit gross, but bear with me because I'm going to get to an important point. So this article is about a disease called guinea worm. Disease is a disease that's been mostly eradicated around the world. It remains in a few countries and in Africa. And I wrote this article for an audience in Puerto Rico where this disease doesn't exist. And so here's how I started the article. I'm going to live translate. So it says, imagine that a worm about 3 feet long and as thin as a spaghetti emerges from your skin an inch at a time for several weeks. Now, I know, again, that's gross, but what I wanted to do with this story was connect and create empathy with the people who suffer from this disease, to then go on and tell the story of a scientist called Ernesto Ruiz-Steven, who was leading the efforts back then when I wrote this in 2006 to eradicate this disease. So although this disease doesn't exist in Puerto Rico, there was a connection to the Puerto Rican audience because the scientist leading the effort is Puerto Rican. And by creating that empathy with people through that little story at the beginning, I really wanted to make this come alive. And this is one example of the work that I've been doing with Ciencia Puerto Rico, but these strategies can be applied to anything. They can be applied to books. This is a book that we published in 2011. And this was the first collection of essays written by scientists for Puerto Rican audiences about Puerto Rican science. We've also applied this to different efforts in science outreach and formal and informal science education, meaning education that happens in and outside of the classroom. We can apply these strategies to multimedia content. So I'm going to share a video that my team and I produced for a project called Aquí Nos Cuidamos, which loosely translates to Here We Take Care of Each Other. So I'm going to show you this video. The video is in Spanish and sign language. It's captioned in English. And then I'm going to talk through how we have applied storytelling and culturally relevant science communication to many different aspects of how we created it.
La pandemia de COVID-19 nos ha forzado a vivir tiempos duros, complicados y hasta desesperantes. Nuestros hogares, nuestras comunidades, nuestros corazones, nuestras mentes y nuestros bolsillos han sufrido mucho. La COVID-19 ha retado todo lo que nos hace boricuas. Juntarnos en familia y con amistades, hacer el bembé, chinchorrear y hasta darnos un abrazo. Cosas que antes eran parte de nuestra vida diaria, hoy nos ponen en riesgo de contagiarnos con el coronavirus. Pero la ciencia nos enseña que, aunque tengamos que modificar nuestros hábitos, no tenemos que perder nuestra esencia boricua. Si seguimos practicando las medidas de prevención con la estamina y el compromiso que nos distingue, lograremos volver a una cotidianidad. Antes y después de vacunarte, ponte la mascarilla sobre nariz y boca y mantén al menos 6 pies de distancia de personas que no vivan contigo. Desinféctate frecuentemente las manos con agua y con jabón o con alcohol 60% más. Evita las aglomeraciones de personas y los espacios públicos cerrados que no permiten que el aire circule. Y si te juntas con personas, hazlo afuera o al aire libre. Busca maneras creativas y aprovecha la tecnología para conectar con tu gente, porque es distancia física, no social. En comunidad, con conocimiento y prevención, así es que salimos de esta. Les boricuas tenemos 2 herramientas poderosas y sin iguales para vencer este reto: la ciencia y la solidaridad. Por ti, por tu familia, por tu comunidad y por Puerto Rico, practica las medidas preventivas. ¿Por qué? Porque aquí nos cuidamos.
So again, this video is part of a project called Aquí Nos Cuidamos, and it's a project that promotes COVID-19 prevention and mental health in marginalized communities in Puerto Rico. It has 2 key components. First is a multimedia, culturally relevant, ready-to-use toolkit to provide community leaders, trusted messengers, and media in Puerto Rico with timely Spanish language, science-based tools to promote COVID-19 prevention and mental health. And the second component of it is a community engagement program to help community leaders build their agency and their capacity to use science to prevent COVID, to promote mental health, but more broadly to address their needs and their community priorities. And I shared this video because I think it's a great case study of the many different ways in which storytelling and cultural relevance can be applied. And so one way we did that was through the words, the visuals, and the music that you see in the video. For example, in terms of words, we use everyday words. In the video, the voice you heard in the video is my colleague Edmi Ayala Rosado, and Edmi speaks the way we speak in Puerto Rico. She uses everyday words like bembe, which means a big boisterous party. And so we also have the imagery, the visuals. You see instruments here. These are instruments that we typically play during the Christmas holiday when we usually have our bembes or these big parties. You also see in the video Puerto Rican communities represented. In Puerto Rico, anywhere you go, you're gonna see houses like this one, cement houses, like kind of like block style. But what I want you to notice are the windows. A lot of houses in Puerto Rico have window bars, and many of them have decorative window bars. And so in the imagery that we use, we included these homes that look like, you know, probably the homes many people in Puerto Rico live in or even grew up in. And then finally, the people, although they're illustrations of people, they're cartoons of people, they also depict the diversity that you see in Puerto Rico. And then there's the music. The music that you heard is an original composition of a colleague of mine, a friend of mine. And in this, he's not only a Puerto Rican musician, but you can prominently hear el cuatro, which is a string instrument that's typical of Puerto Rico that is sort of like a guitar. The video also emphasizes empathy and shared values. The video begins by recognizing how difficult the pandemic has been socially, emotionally, economically. Over and over again, we underscore this idea of, you know, you're taking care of yourself, we're taking care of each other, and you're doing it for you, you're doing it for your family and for Puerto Rico. So again, we're underscoring that empathy for the other, and really that solidarity, which is this idea of taking care of each other, of collective care, is a key cultural value in Puerto Rico. The video also ties protective behaviors to our values and our identity. You know, we very practically tell people avoid gatherings and enclosed spaces because they are riskier. You know, the risk of getting infected with the coronavirus, it's higher if the ventilation is poor. And so we're using storytelling and cultural relevance to communicate risk and to promote prevention or preventive behaviors. And so we not only say avoid gatherings and enclosed spaces, but we also say, if you still want to get together with people, take advantage of the outdoors, take advantage of outside spaces, because in Puerto Rico, the weather is nice all year long. We have a lot of options to gather outside where the risk is lower. And even in the name of the campaign, and one of the key messages of this video is it's distancia física, no social. It's physical, not social distance. And this video is part of a larger campaign with the same name. And you know, the name of this campaign is not only action oriented and underscoring a protective behavior, but it's really pushing back against the idea of social distancing. We're really emphasizing physical distancing because that's what keeps us safe. We know that social distancing harms our mental health. And in Puerto Rico, this idea of socially distancing from others, it really goes against our way of being and our culture. And so we decided to really emphasize the idea of physical distancing, and that there are ways to stay socially connected while keeping a physical distance from others. Another thing that this video really exemplifies is how storytelling and cultural relevance can support inclusion and accessibility. One of the things that you might have noticed is that the video is in sign language besides being in Spanish, and that the interpreter is prominently featured in the video. And that is something that you rarely see. If you see, and I underscore if you see a sign language interpreter, they're usually really small in the corner of a screen. And so because we were able to connect with the deaf community early on in our design process, we made a decision to prominently feature the sign language interpreter. And we created all of our videos with this in mind. Our graphic designer, Ramón González, he really designed our videos with taking into account that the sign language interpreter would be prominently featured on the screen. And further, our connection and our continued collaboration with the deaf community influenced our animations and how we created our content throughout the project, because we learned that, you know, deaf people process visual information differently. Another way in which we brought in inclusion and accessibility into this project was by keeping in mind the realities of our key audiences, which are different marginalized and vulnerable communities in Puerto Rico. So that was one of the reasons why our content is multimedia, so that it could be distributed online and offline. For example, videos like the one I shared were not only, you know, shared on social media, but they could be shared on WhatsApp and via text message, but they were also distributed and broadcast as public service announcements by TV stations in Puerto Rico. And so we were really thinking about this multimedia quality of the project to make sure that the content would reach as many people as possible and would take into account the fact that people consume information differently. With things like recommendations of masks, now with the Omicron variant, is really important that we use better quality masks like the K95s or N95s. But we know that these masks are harder to find and they're more expensive. And so besides telling people, you know, you should be upgrading your masks if you can, we were offering a lower cost alternative, like use a surgical mask underneath a cloth mask, because these are more accessible to the populations that we are serving. And then finally, another example is in our mental health campaign. We have a manual with suggested activities that people can do to promote their well-being. And we made sure, and particularly I want to recognize our project assistant, Xavier Ortiz Torres. He really focused on bringing together activities that would be easy to do no matter where people lived or their level of income. We have also applied storytelling and cultural relevance to our community engagement. And I mentioned this project that we've been working with community leaders, and this has been critical for us because community leaders in Puerto Rico are trusted messengers, and they're often first responders. And sometimes they're the only responders to crises and the needs and priorities of their communities. So we knew that if we wanted to reach these communities, we needed to work with them. And so one of the things that we did is we recruited 10 leaders from across Puerto Rico as project ambassadors. And we provided them with microgrants, with workshops on how to use the toolkit and how to do vaccination clinics, how to deal with misinformation, how to care for their mental health and the mental health of their communities. We've also provided them with communications and graphic design help, and really created a community of support with these 10 leaders that you see here on the screen. And they really represent the diversity of communities and realities in Puerto Rico. We have some of our ambassadors who are deaf. We have ambassadors who are religious leaders, people who live in public housing, in rural communities. And so by working with them, we have really facilitated that then they can go and engage their own communities with COVID-19 prevention and promoting their mental health. And I want to share some of the work that they've done. And so here you see Sor Faustina. She's a nun, and she set up a vaccination information table at her local bakery, because bakeries are a key community gathering place in Puerto Rico. They're where everyone goes and they have their cafecito, and where they get bread, but they also break bread with each other. And so she decided to meet her community where they were to talk about vaccination and the importance of getting vaccinated. Here you see Jamilet. She's one of our deaf ambassadors, and she organized different events for the deaf community in her region, from COVID-19 testing to distributing masks and hand sanitizers. Here you see facing, you see her back, you see the back of her t-shirt. This is Jessica. And she is one of our community leaders. She's been organizing vaccination clinics. And at this point, I think she's helped probably thousands of people in Puerto Rico get vaccinated through her work. In the middle, you see a banner, you see Lucia. Lucia is a community leader in a public housing project in Puerto Rico. And one of the things that she did is she really wanted to not just promote COVID prevention messages, but she wanted to showcase her community. And so around her in the middle, in the white circles, you see pictures of people in her community, along with messages of for our community, we get vaccinated, we get tested. And so they're representing the values of their community, of that collective care through this banner. And then finally, you see, you don't see her on the screen, but this is part of the work that Laurie did. And what Laurie did is she and her community restored this children's park that had been abandoned in her community, because she knew that her community needed a low risk outdoor space to start coming together to heal after months of lockdown. So they restored this park, and as part of that restoration, they painted a mural, which you see in the back, with preventive messages from our project, Aquí Nos Cuidamos. And so these are all examples of how storytelling and culturally relevant science communication can connect science to the culture and realities of different publics. We have, through these strategies, Aquí Nos Cuidamos is an example of how we can make science pertinent, more accessible, and most importantly, actionable for folks and for different publics. Campaigns like this one can also make people feel seen. Like we made the deaf community feel seen by prominently included the interpreter. And then we have, through this work, we have improved the agency and capacity of different vulnerable populations to leverage science to address their needs and their priorities. So these are some of the things that storytelling and culturally relevant science communication can do. I want to share now a different example of how storytelling and cultural relevance can change perceptions about people of color and marginalized folks in science. And this is part of my work with the Science Communication Lab. And a few years ago, I had the opportunity to produce a series of short films called Background to Breakthrough. And Background to Breakthrough has featured 3 different scientists: Esteban Gonzalez Burchard, who is a physician scientist at the University of California, San Francisco; Rebecca Calisi Rodriguez, who is a neurobiologist at the University of California, Davis; and Manu Prakash, who is a bioengineer and inventor at Stanford University. And I really wanted to produce this series to tell stories of people of color, of people of marginalized backgrounds from different perspectives. And I want to tell you a little bit about my process so that you can understand how we approach this. So one of the things that I had to do while I was the lead producer in the series, I had to do a lot of background research about the folks that we were going to feature, to understand, who they are, what they do, and to also see what other stories are being told about them. And in that process, I came across this BuzzFeed article about Esteban's work. Esteban is, again, a physician scientist, and he researches health disparities in asthma. And, I was like, oh, this, just by the headline of this article, it talks about his fighting for more studies on genes and racial differences in health. I was like, this is kind of along the lines of what I would like to tell, the story I would like to tell. But then I started reading, and I was really taken aback by the first paragraph of this article. And I'll read it to you so that you kind of understand why. The paragraph reads, Esteban Burchard is pissed. He's angry that people of color are being sidelined by a medical revolution spawned by the Human Genome Project. He's angry that when non-white scientists apply for federal dollars to try and turn things around, they find a deck stacked against them. And he's angry that he, a middle-aged Latino man with a wrestler's build, can't walk his dogs without getting stopped by the police. Now, let's be clear. It's very reasonable that Esteban is angry about all of these things. I'm angry about all of these things. We should all be angry about these things. But I was also angry when I was reading this, because I felt that this article was perpetuating the stereotypes about middle-aged Latino man with a wrestler's build. And so one of the things that I wanted to do with Background to Breakthrough was really push against some of these common stereotypes and tropes about people of color and marginalized folks in science. So I'm going to show you a clip from one of the videos that we produced about Esteban.
Well, there are clearly racial differences in drug response. One of the best known one is for Ceravent. This is the package insert for Ceravent, and I want to tell you why you don't read it. And it's because it's this huge roadmap of small text. But if you look here, it says that if you're African American and take this medication, you have a 7-fold increased risk of dying. If you were a parent, would you let your child use this? We're identifying genes and risk factors that will benefit Latino communities, African American communities, Asian communities. We know that diseases differ by race. We know the severity differs by race, ethnicity. We know that drug response differs by race, ethnicity. That's how race is involved in clinical medicine. And it's important that we address the lack of diversity in medicine and biomedical research. And we're trying to do that here.
So in this clip, Esteban is addressing some of the things that that BuzzFeed article mentions he's angry about. He's talking about the exclusion of people of color from clinical studies and how that leads to, to issues like the one he mentions with Ceravent, with this drug that has a disproportionate negative impact on African Americans. And it wasn't really discovered until the medicine was out in the market, because Black people, African Americans, were not really included or are not typically included in clinical trials. But he's not angry. He's certainly passionate about it, but he's an angry. So one of the things that I hope that these two examples really highlight and contrast one of the key goals that I wanted to achieve with Background to Breakthrough, and is that I wanted to change stereotypes. This particular stereotype of deficit, that people of color, that people that come from marginalized backgrounds succeed in spite of their backgrounds. Many of the stories that I was seeing and that I saw in my research were, kind of the typical underdog story. Person grows up in need and faces many challenges, but still they succeeded and became a scientist. Yay for the underdog. And while I don't deny that those challenges exist, there are many systemic challenges that make it much more difficult for folks from marginalized backgrounds to succeed. I also wanted to tell the stories of people like me and many people that I know that succeeded because of their backgrounds, that their life experiences, their identities, the things that they've been through, that they live through, are a big reason why they are successful and they're able to do extraordinary things in science. And so before I end, I want to share I want to highlight some of the key lessons from my work doing storytelling and culturally relevant science communication. And the first is that it really requires cultural competence. It requires an awareness, a willingness to educate yourself, to understand your audience's culture. And that encompasses identities, customs, languages, socioeconomic status. So it requires deep work to understand the culture and how that influences the way that people understand the world. It also requires awareness and recognition of inequities and privileges, particularly your own privileges as a storyteller. I often think about the many different privileges that allow me to do the work that I do, the education that I've received, the fact that, although I'm a Puerto Rican, Latina, and I'm one woman, often when I enter spaces, people see me as white, and I know that gives me great privilege. And so I often think about, how do I leverage those privileges to address the inequities that marginalized communities have faced and continue to face. It requires empathy, humility, and listening. This is hard work, and you will mess up. It's not a matter of if, but when. And so it requires humility to recognize the things that you don't know, the perspectives that you're missing, and most importantly, to say sorry when you mess up. And then finally, it requires intentionality. You have to be really intentional about what you do, what you say. Reciprocity is really important, particularly when you're working with and in community. You have to listen to people. You have to, understand their perspective. You have to value what they bring to the table. There's constant reflexivity, thinking about what you're doing, how you're doing it, is it working? How do I adapt? And I want to underscore that last point of adaptability. One of the key things that my team and I from Aquí Nos Cuidamos have learned, in particularly in working with communities, is the importance of adaptability. Collaboration with marginalized communities moves at the speed of trust, and each community has their own time because they have their own realities, they have their own history. And so it's really important that while you have goals and you have a clear framework of what you want to do, that you remain adaptable and responsive to what the community needs. And so to summarize, I've told you a little bit about storytelling and culturally relevant science communication through the lens of my work with Ciencia Puerto Rico and the Science Communication Lab, and how it can connect science to an audience's culture, meaning their context, their identities, their previous knowledge, how they can make science pertinent, more accessible and actionable, and they can make people feel seen. How storytelling and culturally relevant science communication can engage different publics and counter stereotypes and change perceptions about marginalized folks. And I think it's really important that we continue to think about how strategies like storytelling and culturally relevant science communication can make science more inclusive, because they are grounded in inclusion, equity, and intersectionality, and it can really move us forward to that aspiration of making science more accessible and actionable for everyone. So with that, I thank you again so much for the honor of being the Johnston Lecture of 2022. Thank you for the invitation. Thank you for your attention, and I look forward to your questions. And so now I am going to invite Dr. Holly Smith to join me for the Q&A session.
All right, thank you, Monica. This was such a wonderful presentation. We really have benefited from hearing about your approach to storytelling and culturally relevant communication. Some of the things that are clear lessons are the value of empathy and shared values, also the importance of building trust in the communities that you're working with. And so we have about 30 minutes for question and answer, and we have some questions. So I think we're going to start with a real practical approach to questions, thinking about how this work happens. And so we have a few questions, particularly about the COVID campaign. And people are wondering, can you talk a little bit about how others might approach this work in terms of building a team, how much time it takes, the budget to accomplish work like this? So this work is so inspirational. Can you talk to us a little bit about the nuts and bolts behind the campaign, the team size, and the time commitment to do this kind of work?
Yeah, thank you for that question. Well, I have a small but mighty team, and I know some of them are in the audience. Hola Edmi, hola Ramwing, hola Xavier, no sé si estás por ahí. And I really want to recognize them. You know, I'm fortunate enough to be a spokesperson for this work. But what you see is truly the result of teamwork. And I think the most important thing for us has been, we have an interdisciplinary team. And so we have somebody who's a journalist, somebody who's a designer, and then somebody who has a science and theater background. And I'm a scientist by training, and I'm a communications expert. So that interdisciplinarity has been really, really critical for us to do the work and to analyze what we're doing and to apply different strategies to make part of, what you saw was only a sliver of all the things that we have done. And so that's been really important. Because we have a small team, we were really intentional from the beginning about creating systems, different systems that would allow us to, things from like writing copy to creative content to rapid response. Like the pandemic has been evolving quickly. And so there are always themes that are emerging. And so one of the things that our graphic designer, Ramwing, did is he created, we use Canva as part of our design tools. And he created these templates on Canva that would allow us to, plug and play pictures and copy and icons and things like that. And so creating systems that would work for our work style was really, really important. Always being adaptable, as I talked at the end, adaptability is really very important, has been really important for us to respond, not just to the needs of the communities that we work, but the needs of our team. This has been incredibly fulfilling work, but it's a lot of work. And it's a lot of work happening in a global pandemic in Puerto Rico, where there are multiple crises that people are dealing with a day. And so we've taken a people first approach in everything, not just in how we work with communities, but how we work with each other. Like we've really applied this idea of taking care of each other to how we work as a team. Collaborations have also been important. We've had to recognize that what our bandwidth is and our limitations, the limitations of our expertise and our capacity. And so to address some critical needs, we've established collaborations with nonprofits and community-based organizations, government entities to try to increase our impact and amplify our reach. So yeah, I'm really proud of when I think about all the things that we've accomplished and with relatively little resources, I'm really proud of what we've done. And I think the way that we've worked on this project, the way that we have engaged with the communities that we've been working with can really be a model, not just for other folks who want to do this type of work, who want to apply these type of strategies, but really to address other needs and priorities. Like right now, the urgent topic is COVID, but there are things like climate change that are having a real impact right now. in communities in Puerto Rico, access to clean water, nutritional security. And so I think Aquí Nos Cuidamos is really a model for our work moving forward, but also for the work of others.
And I think that's a great segue into the next question. Thinking about how other people might apply these lessons or think about this model for campaigns, can you talk a little bit more about how you actually built trust within the community, or how others who might want to do community-based work can build trust?
It takes time. It takes time, and you have to be willing to put in the time and the patience. You can't rush building trust with communities. As I mentioned, I like to talk about collaboration moves at the speed of trust, and trust with different communities moves in a different time. And so it's really, really important to build that into your workflow. Knowing that you may have a plan, you may have a timeline, but then when you start trying to connect with certain communities, you can't find someone, or that community is not responding. They're not responding to your emails. They may not even respond to emails, period. Like, that's one of the things that we have to adapt. Like, in Puerto Rico, people don't use email the way it's used in the US, for example. It's much more likely that you're going to be able to connect with someone by giving them a call or sending them a WhatsApp message. And so really adapting to what the community needs, what works for them, is really, really important. Something else that's really important is kind of having brokers, people that can kind of broker that introduction or that relationship with that community, especially if you've never worked with that community, or if you're not a member of that community. Having someone that can help you learn about them, understand them, or make that introduction is really important. Before we did Aquí Nos Cuidamos, Ciencia Puerto Rico had never done this type of community engagement work. And so we relied on collaborators who did have community engagement programs to help us understand, how do we get started? Who do we talk to? Who should we be keeping an eye on? How do we reach out to them? What's their preferred way to hear from people? And I really want to underscore the value of brokers too, with the relationship that we build with the deaf community in Puerto Rico. I'm not deaf. I've never worked with deaf people before. And so I really knew very, very little about the deaf community before doing this work. I knew that they are particularly marginalized. Even access to basic information is very difficult for them. And so we were fortunate that we connected with an interpreter, Evelyn Medina, she's the interpreter you saw in the video. And she really she shepherded us in building this relationship with the deaf community. She was incredibly generous in teaching us about deaf culture, and helping us understand things like, our original plan with the videos was to include captions. And that was it. And when we talked to her, she's like, captions are not enough. There is the level of proficiency, of reading proficiency in the deaf community is not uniform. And so some people don't know how to read well enough to understand captions. And so you really need interpreters. And so we needed to adapt. We needed to find the funding to pay the interpreters and make sure that everything had interpreters. And so having those brokers is really, really important. And then the last thing I'll say is again, humility. You need to recognize your blind spots. What are the things that you don't know? And seek to educate yourself, not expect that those communities are going to educate you. You need to have the humility to say, I'm sorry, I didn't know that. I'm sorry if I offended you by not knowing that, or by saying this in a particular way. That is really, really important, because all of those things help build trust and really that's the most important currency that you have when you're working with communities, particularly those that have been marginalized and oppressed.
I love how you're talking about this embodying of this two-way flow of information, and also being open to being transformed for people on both sides of this communication. So I would love to ask about how you identified the project ambassadors for the campaign. Did that come from these brokered relationships, or did people nominate themselves?
So we did a competitive application process. So as we were creating this project, particularly after we launched our first campaign, one of the things that we realized, like, people would see it and they were like, oh, it's so pretty, this is so cool. And we were like, okay, like, great, thank you, but we want you to use it. Like, I appreciate that you see it and they're like, it's so pretty, but I don't want just that. I want you to use it. We created this toolkit so that you would use it, that you would own it. And so we realized a couple of things. We realized we needed to do more in terms of outreach and in terms of showing people the possibilities of the toolkit and how they could really own it and apply it to their own different realities. And then we realized, well, there is an opportunity for capacity building and for relationship building here. And so we started doing workshops, but then we thought, we need, if we really want to expand our network with community leaders, what about creating an ambassadors program? This wasn't something that was in our original plan. It was one of those things that we did in response to what we were seeing, what we were hearing, what was happening with the project. And so we thought, let's create an ambassador program where we recruit folks that are leaders of leaders. There are community leaders in Puerto Rico. They establish these mutual support or mutual aid networks. And there are certain folks in those networks that are leaders in the region or in a particular community. And so we thought, let's recruit these leaders of leaders. And so we put out an application. And that's how we found, how we recruited these 10 ambassadors that are still working with us in different efforts. And then they're going to continue working with us over the next year.
Okay, that's so wonderful. We have a question particularly about how you get people interested in data or how you visualize scientific data. Someone wants to know, do you have any specific recommendations about how to communicate data or visualize scientific data for traditionally marginalized communities? Are there any unique literacy barriers or preferences that exist that you can comment on?
I mean, I think that's really going to depend on your audience. And my first question would be, do they need the data? Like, do they need to see the data? Because I think one of the things, particularly with scientists or people who are trained as scientists, we're like, we love data and we think like, we see data and we're like, ooh, this and that, and we're making interpretation and asking questions. And we think everyone looks at or interprets data or appreciates data the same way we do, and that's not true. I was talking to Dr. Peters earlier, and we were talking about how data is and facts are absolutely critical, but they need to be put in context. You need to tell the story of that data, and I think it really depends on what your goals are, but what does your audience need? If I think about the groups and the communities that we've been working on, I don't know that I would lead with showing them the data. Perhaps the data, it's not about showing them the numbers, but what does that data mean? Like, what is for my day-to-day life, what does it mean that, at any given time we were seeing, I don't know, like 600 COVID cases per 100 people in Puerto Rico? Like, what does that mean for me, for my everyday life? And so for me, the number is not as important to like, what do I have to do? What do I have to do to keep myself and my family safe when we are seeing those numbers in the news? And so I think it's important that you question, what is your audience, and that you ask your audience, like, what do they need? And so how, in terms of visualization, I think what's important is, what visualization is going to help your audience understand what those numbers mean. Data doesn't speak for itself. You need to tell the story of data. You need to put it in context. You need to also talk about the limitations of data, because data, ultimately, it's a tool, right, that helps us understand something, and every tool has its limitations. So it's important that we understand and sometimes that we convey the limitations of data.
Yeah, I think that really goes back to your earlier points about listening and the importance of actually listening when we're communicating, instead of just thinking about what we're going to say or how we're going to communicate. So I know you talked about the video that you presented was just a sliver of the campaign.
Yeah.
And someone has a question about kind of the multimedia environment that we're living in and a limited attention span, particularly for sharing complex scientific information. So can you talk a little bit about how we can show empathy, shared values, and science-driven messaging when the audience's attention is limited?
I think that's where the cultural relevance comes in, right? Like, if you're making something very pertinent to people's lives, like one of the things that we've done with Aquí Nos Cuidamos is try to connect some of these concepts, the science concepts, to what people do every day, or what's going on in the news. There's something that people are talking a lot about, a particular issue, and so we try to connect that concept to that particular issue. And so I think it's about making it pertinent. And in our case, we really focused on making things actionable. We were constantly listening for and what were people wondering, like what were the concerns, and then we were trying to connect the information we were sharing with those things that people were concerned about, were hearing a lot about, to make it really pertinent to their lives, because if it's something that matters to them, they're more likely to pay attention.
Perfect. I think switching now a little bit to the background to the Breakthrough campaign. Someone would like to know, can you talk about how you navigated actually building your strategy and including community engagement for the video projects for that specific campaign?
So for that project, we didn't do as much community engagement. We were really producing the stories. Some of the things that we've done for Background to Breakthrough have been, bringing it into classrooms, and the videos have been used to lead discussions about ethics in science and medicine, and how clinical trials are designed, to talk about curiosity, to talk about communication and how you can use animations to communicate science. And so the community engagement we have done has been, it hasn't been like the one we've done for Aquí Nos Cuidamos. It's been more about kind of sharing the videos with people, and for example, showing educators how they can be a tool for them in their classrooms.
And I'm curious, what has been the response from the scientists that you reach out to hoping to share their stories?
I mean, they've been really generous with their time. I think for me, one of the really neat things have been the opportunity to really connect with these people. Like I I thrive in community. I thrive. And one of the things that I love about communication and allowing to connect with people. And so I think they really appreciated the attention we pay to their stories and how much we listen. You know, these videos are, maybe the longest one is about 10 minutes long. But, you know, we did a bunch of pre-interviews and research, and for some of them, we did, for Esteban, which we produced 3 videos on him, we had like more than 10 hours of interviews. And so we really had the opportunity to get to know these scientists, and that was really, really important as we were editing the story, so that we could really stay true to their stories and to really highlight through their stories some of, you know, what we really wanted to do with the series, which was, you know, how their background, the background of each of these people really directly contributes to the research and to the innovation that they do today. And something else that we've heard from scientists that we worked on, not just on this project, but other film projects that that we've done in the Science Communication Lab, is how their views of storytelling and like how powerful storytelling can be to convey science. It's changed the way they think about it and the way they think about communication in general.
And thinking about kind of co-producing these stories and comparing the BuzzFeed article compared to the stories that you produced, did you allow the scientists to kind of get involved in that editing process where, you know, there was this kind of co-production of the story, and so they had a little bit of control over how the story was told?
No, not at that stage. We certainly, you know, we see them, we did see them as partners in you know, helping tell the story, you know, in what they thought was important to highlight, things that they wanted to make sure that were included or not included in the stories, you know, what the essence that they wanted to portray in the videos, but they were not involved in the editing or the post-production. But, you know, we felt that with the relationship with us, we established with them through the pre-production, you know, before we started filming and during the filming, that really allowed us to honor them. And, you know, we, for example, with Rebecca, we had, you know, she provided pictures of her. So, and Esteban did as well. So they trusted us with, you know, these precious memories, and that we would, you know, we would use them well to represent their stories, but they were not involved in the editing per se.
And thinking about kind of like the impact of this work, you talked about one, I don't want to use the word metric, but one way to see success is this actually changed the way that some of the people who participated thought about storytelling. Can you talk to us a little bit more about how you measure or kind of check in to see the impact of this work?
Yeah, that's an important and very challenging question, because assessing the impact of these projects, it's hard. It's hard because, you know, sometimes the metrics, they don't quite capture the impact, or they don't exist. And I think the reason they're challenging is we don't have the bandwidth, we don't have the expertise to do the assessment. But I think, you know, we've been thinking more creatively about what does it mean to have impact. For example, with Aquí Nos Cuidamos, we have analytics, like, you know, how many people are downloading on content and visiting the website and social media and all of those things, and how many TV stations are using our public service announcements. But I think for me, the most important thing that we've accomplished and the most impactful thing we've accomplished is the relationships we have built with our community ambassadors. And, you know, if you only look at that from a quantitative perspective, it's only 10 leaders, right? It's only 10 community ambassadors, and that might not seem like a lot. But when you look a little bit deeper and you look at the quality of those relationships, the effort, the energy, the time that it took us to build that trust. We've heard from some of these community leaders like, oh yeah, I applied to this program because I was like, yeah, that sounds cool. But then they were selected, and we were doing these meetings and creating these WhatsApp chats, and they were like, I don't know about you. Like, I don't know why are you bothering me? And it took us a little bit to kind of get them to be on board. But now, we've seen them say very proudly, I am part of Aquí Nos Cuidamos. I am an ambassador for this program. And to me, that means everything, and that kind of impact, it's hard to capture. So, I'm a scientist. I love data, and I think it's important to do quantitative assessments. But for me, it's really about the quality of the relationships. And, I think with projects like the ones I shared here, part of it is, we're trying to create a cultural shift. We're trying to create a cultural shift of how people see scientists of color. We're creating a cultural shift of how communities, marginalized communities, are leveraging science. We're also trying to break traditional perceptions of who is an expert in science. Like, our community leaders are experts in science. They have so much local scientific knowledge that is often not recognized. It's not valued. And so part of what we've been doing is we've been highlighting what they do. And we've been saying like, no, you're absolutely doing science. Like, what you know is as valuable as what I know. It doesn't matter who has a title or who doesn't have a title. And so I think that's been, those are some of the really important things. And those can be hard to measure.
I think it's one of the great challenges of this type of work, because getting funding and showing some kind of return in ways to promote this work long-term is a key challenge that I know has appeared for people trying to do this work. So how do we capture some of this important impact that is really hard to put into numbers?
Yeah, and we're actually doing that through storytelling. One of the things that we're doing is we've been, for example, with Aquí Nos Cuidamos, we've been having conversations, one-on-one conversations with the leaders. Edmi has been doing these interviews with the ambassadors and really getting to know them better and understanding, how they see the role of science in their communities, how they can use science as leaders. And so we're using storytelling to kind of share the impact, because I think, some of the things that they've done and that they've shared with us, I think that there's no better way to capture the impact than by telling their stories and like sharing the impact of the project in their own voices.
Yeah, sharing their voices and their experiences. And I think we have another question kind of about this idea that you were just talking about, different types of knowledge and how do we honor and bring together different types of knowledge. And so someone wants to know, in your work as a scientist, do you do work in terms of co-producing or co-creating science? And can you talk about how that might be different than like a traditional deficit model science communication, where science is done and then communicated?
Yeah. So I'm no longer a researcher. So I'm a scientist because that's my training and that's one of my identities, but I'm no longer doing research or research projects. But one way we're actually pursuing co-creation of knowledge and really impact. And using science is the next phase of Aquí Nos Cuidamos is a project that's called Laboratorio de Ciencia Comunitaria, or Ciencia Collab, or Community Science Lab. And one of the things that we're going to do is we're going to use design, human-centered design and placemaking principles to work. We're going to continue working with these 10 ambassadors to help them design sustainable projects that address needs or priorities in their communities, things that they identify they want to do. And so we're going to co-create those projects with them through a design sprint. We're going to give them trainings and really help them think and iterate on their ideas of what projects they want to implement. But at the same time, while we do that, they are going to help us design a program that eventually is going to help us help any community leader in Puerto Rico who wants to do a community science project, a project that leverages science and their own community knowledge to address a need or a priority in their community. And so we are, it's not, what we're going to do is not necessarily, I don't know if we're going to be doing research projects, for example, because I don't know what the ambassadors are going to want or need to do. But we're certainly taking that co-creation of projects and of knowledge further through this community science lab.
And I love how this one framework is leading to such long-term community impacts, and this idea of really investing in communities instead of any kind of helicopter approach where you're there for just a short period of time.
Yes. Yeah, we certainly, we see this as a long-term effort to build capacity. In one of the core values of what we've done with Aquí Nos Cuidamos and what we do more broadly in Ciencia Puerto Rico is to put science in service of Puerto Rico. And so with projects like Aquí Nos Cuidamos and the Ciencia Collab, we see this as it's about capacity building. And so, we're going to start with helping community leaders craft these projects in sustainable ways and support them in their implementation. But long term, what we want is to build their capacity and their agency to use science to address whatever need they have. It doesn't have to be with this project, that it's really going to influence and change the way that they approach addressing their needs and their priorities. And, one of the things in Puerto Rico, there's this concept called autogestión, and it's like, it doesn't have a good translation. It's like self-reliance in a way. And so marginalized communities in Puerto Rico have had to rely on each other and on themselves because of chronic institutional incompetence and colonialism. And so in many instances, relying on each other has been the only way to survive. We saw it poignantly after Hurricane Maria in 2017. Like, if communities had not established these mutual aid networks, people would have died. More people would have died. Like, thousands of people died in Puerto Rico, largely because of government incompetence. And if it hadn't been for these mutual support networks, more people would have died. But what we think is that projects like this one can offer ways to move from self-reliance as a way of survival to self-reliance and that collective care and that mutual support as a way to thrive, to have the resources to live with dignity. And so what we're trying to do is really build that long-term capacity.
I love that. I think we have time for just one more question. So I'm going to combine two questions from audience members into one. And it's really thinking about resources and where they can learn a little bit more. So one question is, I work for a big green conservation organization, and it seems to be struggling with understanding ethical storytelling when it comes to sharing the stories of engagement with communities of color. We're trying to give guidance from the engagement side, but it's really, really frustrating. Are there some resources that you can suggest besides sharing this amazing presentation that can help them understand principles underlying your work? And then there was a similar question: do you have any resources for decolonizing methodologies?
Oh, those are all really great questions. I know I've seen, resources on ethical storytelling. I can't think of anything from the top of my head, but I can find some things and maybe share them with Lena, and then they can be shared via email. I shared, and it's in the chat right now, but I believe this may be shared later on via email too. I shared a list of references that have informed some of the work that I presented. It's certainly not an exhaustive list, so you might want to look at some of that. There's one person that comes to mind, Dr. Chanda Prescott-Weinstein. She's an astrophysicist, and she's also an expert in gender studies. I think she's at the University of New Hampshire. And if you Google Chanda Prescott-Weinstein, decolonized science, she has this ongoing list of articles and books and resources that you can read about, that I have found really valuable in thinking about decolonization of science. You can also check out inclusivescicom.org. So this is it's more than a conference, it's really a movement built out of the University of Rhode Island, which I know you're familiar with, Holly. And there's a conference, but there's also a lot of resources there in that webpage to kind of think about particularly decolonizing science. The past conference last year was all about decolonizing science. That was one of the main topics. But yeah, I would have to get back to you on ethical storytelling.
Perfect. Well, I think that's a great way to end up, and we will actually share all of the references and resources that have been shared in the chat. We will also share a recording of this with everyone who registered and attended tonight. So thank you, Monica, so much. This has been such an absolutely fantastic evening, and I so appreciate you sharing your insights with us. Again, for everyone who tuned in tonight, thank you so much for joining us. We will be sharing the recording on the SOJC social media channels and the YouTube channel later this week or next week. And please feel free to share those with your networks and help us share this message. I hope you all have a great night.
Thank you, everyone. Have a good night.